Halloween is just around the corner, and children and adults alike may be tempted to wear decorative contact lenses. Our next speaker is here to tell you why wearers should beware. Her topic is blindness in the search for beauty, adverse events from the use of decorative contact lenses in children. Dr. Michelle Tarver attended Spelman College in Atlanta, Georgia, where she received a bachelor's degree of science in biochemistry. She completed the MD PhD program at Johns Hopkins University School of Medicine in 2003, and then a residency in ophthalmology with fellowship training in ocular inflammation at the Wilmer Eye Institute at Johns Hopkins. She joined the FDA in 2009, where she works to ensure that ophthalmic devices are safe and effective before they enter the US marketplace. Dr. Tarver is actively involved in research on ophthalmic devices and continues to see patients at Johns Hopkins Wilmer Eye Clinic and the Walter Reed Medical Center. Please join me in welcoming Dr. Tarver.
Thank you for the introduction. So I'm going to talk to you today about the impact of decorative contact lenses on the eye health of children. As an employee of the Food and Drug Administration, I have no financial relationships to disclose. According to a recent survey conducted by the Centers for Disease Control and Prevention, approximately 41 million Americans wear contact lenses. Of these contact lens wearers, 68% are female and 10% are under the age of 18 years old. This number is projected to increase significantly in the upcoming years. Before a patient can be prescribed a contact lens, they first must undergo a comprehensive eye examination and be fitted for the lens. Part of the fitting process involves evaluating the lens movement, whether or not the lens has accumulated any deposits, how well centered the lens is, and how adequately the tear film bathes the lens and provides nourishment to the underlying cornea. The patient is also asked to wear the lens for a while and see how comfortable it is. When the prescription is dispensed to the patient, they get not only a corrective power prescribed, but also the size, the shape of the lens, and the particular material that they are willing to tolerate is also listed on that prescription. The patients are also instructed in the appropriate care of contact lenses, that is, how to clean and disinfect them, the importance of washing your hands before you put the lens in and remove the lens from your eye, and the importance of keeping the lens case clean and periodically replacing it. The amount of time that a patient wears the lens in a given day is also told to them, and when the lens should be discarded and replaced with a new lens is told to the patient at that visit. However, a large number of patients do not follow these regimens, and about 80% of contact lens complications are related to deficient compliance with the wear and care schedule. In addition, established contact lens wearers don't follow the recommendations either. In fact, 98% of them do not follow it. This can result in some poor outcomes. In fact, the most devastating complication is microbial keratitis. In this condition, patients can completely lose their vision, and it is a condition where the cornea, which is the clear portion of the eye, is infected by an organism that breaks down the corneal tissue. The signs and symptoms of that condition is decreased vision, eye pain, severe eye redness and discharge, tearing, and light sensitivity. In addition to having healthcare providers ensure that the lenses are prescribed appropriately and are safely worn by patients, the Food and Drug Administration is also involved in ensuring that the lenses that are available in the US market are safe and effective. The Center for Devices and Radiological Health clears the lenses and ensures that there are no concerns with how well the lens performs. We also watch it once it goes onto the market to ensure that the lenses remain safe. The Federal Trade Commission is involved in the regulation of devices once they enter the US marketplace. Contact lenses are medical devices and require a prescription in order to be dispensed. The Federal Trade Commission ensures that this occurs. In 2005, the Food, Drug, and Cosmetic Act was amended to classify all contact lenses, including decorative ones, as medical devices. And when I say decorative contact lenses, I mean ones that also have no power. These lenses all must be reviewed by the Food and Drug Administration, and they must be dispensed with a prescription. There are many reasons to color contact lenses. One is to aid in the insertion and removal of the lens. One is to enhance the natural color of the eye. But the focus of our talk today is on the opaque tinting of the eye, where we're changing the eye color or giving the eye a costume or theatrical appearance. In 2007, legally sold decorative contact lenses made up 7% of the soft contact lens market. Please note that I stated legal decorative lenses. There is a very large illegal market that we are constantly dealing with at the Food and Drug Administration. We do not recognize over-the-counter sale of contact lenses as legitimate or safe. And in fact, the Federal Trade Commission has taken several actions against internet sellers of contact lenses. Adolescents use contact lenses for many reasons, and they hit every demographic population. They like to change the color of their eyes. There is a large market in certain Asian countries for enlarging the pupil area of the eye, as you can see in the bottom portion of the slide. There's also adolescents who are seeking that Barbie look, particularly ones that are into cosplay and anime and goth culture. And then lastly, the lenses are sold for their novelty. This is a Hello Kitty contact lens that we saw in the US market. Celebrities also popularized these lenses, from Michael Jackson's Thriller video in the 1980s to Rihanna on the cover of GQ and Lady Gaga and her Bad Romance video. Adolescents are constantly seeing images of these lenses in people that they idolize. Now, if you're thinking, this is not going to affect my patients, I hope this slide convinces you otherwise. In a survey of adolescents seen in a clinic population in an urban center, 23% stated they wore decorative lenses, and 74% reported that their friends also wore decorative lenses. However, it's important to note that 51% of them did not have them prescribed by an eye care provider. I'd like to give you, unfortunately, a horror story from Cleveland. This is a 14-year-old girl who presented to her pediatrician with eye burning, pain, light sensitivity, and hand motion vision in her left eye. She was wearing decorative contact lenses that she bought from a video rental store. She had no prior history of any eye disease and didn't even need to wear glasses. When she was referred to the eye care provider, on exam it was noted that she had eyelid swelling, copious purulent discharge. She also had a central large ulcer with significant thinning of the cornea. And this thinning makes her cornea very vulnerable. She was diagnosed as having Pseudomonas aeruginosa corneal ulcer or microbial keratitis, and she was hospitalized for 4 days for intensive hourly topical antibiotic therapy. After the infection cleared, she had a lingering scar covering the entire portion of her visual axis, and the significant thinning made her cornea at high risk for perforation. She underwent a corneal transplant. Unfortunately, this is not the only case we have heard of at the Food and Drug Administration. So you may be asking yourself, well, this is not an issue for me as a pediatrician, it's an issue for ophthalmologists. But I would argue that contact lenses are the leading cause of medical device-related emergency room visits, accounting for 34,000 visits annually in the United States. Decorative and internet purchase lenses have a 5-fold higher risk of microbial keratitis than non-decorative lenses or those lenses dispensed by an eye care provider. And as you all know, the first person that typically sees these patients are emergency room physicians, nurse practitioners, and pediatricians. In a study performed by Sauer in France, where he looked at cases of microbial keratitis and compared those who wore decorative lenses to those who did not wear decorative lenses, he found that decorative contact lens wearers had an 85-fold higher odds of buying from an unlicensed vendor compared to non-decorative contact lens wearers. They were also 10 times more likely to not have seen an ophthalmologist. This same study showed that decorative contact lens wearers who developed microbial keratitis were 6 times more likely to be legally blind by the time the infection resolved and to develop the more debilitating forms of infection like acanthamoeba keratitis. So the reason why the FDA is concerned about this is because we receive reports from concerned consumers about these infections, and we are seeing that the most commonly affected group are adolescents and young adults. In the medical device reports that we have received from October 2011 to June of 2015, decorative contact lenses were more likely to cite visual impairment as one of the outcomes compared to non-decorative lenses. This finding was very similar to what Dr. Sauer saw in France. Another reason why the FDA is concerned about these lenses is because they're worn solely as a fashion accessory. There is no medical condition that they are correcting. As a result, these patients often are not fitted by an eye care provider, and they don't learn how to properly wear and care for the lenses. Unfortunately, because they are not getting the lenses from an eye care provider, they are buying them off the street, from the trunks of cars, in beauty supply stores, tattoo parlors, and gas stations. A lot of these lenses have not been evaluated by the FDA. Hence, they are usually heavily contaminated by microorganisms, have color additives that have not been deemed to be safe in the eye, and are made of materials that are not safe in the eye. The question is, are all decorative contact lenses the same? Well, there are some that are cleared and approved for sale in the United States. They have no power, but they change the appearance of the eye. These are typically used for patients who may have had an injury to the eye and want to cosmetically correct it, or people who simply want to enhance their natural eye color or change their color. But many that are sold over the internet and those entering through our ports are not cleared or approved through the FDA. Here are some examples of non-FDA approved lenses that we have seized. And again, this is a list of where these patients are buying the lenses. You can see that the list of medical suppliers is much shorter than the list of non-medical suppliers. What I'd like to point out is that conventions such as Comic-Con, anime, and other conventions of that sort, as well as certain movie release conventions like Twilight and the Hunger Games, have seen an uptick in the sale of these illegal lenses. These are a number of websites that we have found marketing these unregulated lenses. So you're probably wondering, what has the FDA done to help protect consumers? Well, it's a big problem in terms of us being able to capture every single violator of the rule. So we've tried to communicate to consumers. Part of this strategy has involved developing a website that spells out the importance of having your lens fitted by an eye care provider and how to appropriately care for the lenses, as well as where you should purchase them and where you should not purchase them. We've also partnered with the CDC to help create websites and web pages on decorative contact lenses. We've developed a flyer that can be expanded to be made into a poster, or it could be handed out to patients for the eye care providers as well as other healthcare providers to educate these children. We have published consumer-focused articles that we distributed to over 75,000 subscribers during Halloween, spring break, and prom about the importance of buying decorative contact lenses from licensed distributors. We've created a video which you can access on our website, and we've partnered with the American Optometric Association, the Entertainment Industries Council, and artists from American Horror Story to create 2 public service videos to better educate the adolescents about the importance of being fitted for the lens and not buying them in illegal situations. We've utilized social media and have sent out numerous tweets around different conferences as well as to certain groups to try to decrease the utilization of these lenses. We've worked with professional organizations to reach out to consumers and healthcare providers. As you may have noted a few years ago, there was a publication in the Healthy Children, as well as AAP News about decorative contact lenses. And we've also worked with the American Academy of Pediatrics to develop a patient pamphlet. We've done interviews with Medscape to tell the story of the dangers with these lenses. And we've also told professional organizations how to report to us what information needs to be put on the form so that we can ensure that we can find the violators of the rule and protect the consumers. Some of the regulatory actions that the FDA has taken has included stopping the importation of these devices from distributors and from manufacturers that are not cleared for sale in the United States. We've also had 2 undercover operations through the Office of Criminal Investigation. One of them was Operation Double Vision, which was conducted in partnership with the U.S. Immigration and Customs Enforcement and Homeland Security. We targeted illegal importation and distribution of counterfeit contact lenses, and we seized more than 20,000 pairs. Unfortunately, this is only the tip of the iceberg. We also did another operation called Cat's Eyes that was targeting specifically Halloween stores. We charged 12 defendants in Los Angeles with the illegal sale of misbranded and contaminated decorative contact lenses. These contaminated lenses did lead to injuries in adolescents. These charges are associated with a maximal penalty of 1 year in federal prison and fines up to $200,000. We've also worked with the Federal Trade Commission to issue untitled letters to over 100 websites that are selling these lenses without a valid prescription. For every sale they make, it could be associated with a civil penalty up to $16,000. So I'm hoping you're asking how you can help. What we would like is that you report to us any poor outcomes you may be seeing with patients who are experiencing adverse events with decorative contact lens wear. You can also notify the Office of Compliance if you happen to be in a gas station or a tattoo parlor or a tanning salon and you notice that they're selling contact lenses, because none of those venues are legal places for those lenses to be sold. You can also notify the Federal Trade Commission if you notice that these lenses are being sold without a prescription. And we ask that you disseminate this information to school nurses, to other health professionals, to vendors that you see selling it, as well as occupational licensing boards. Please utilize your social media networks and link to the FDA website to disseminate this message. So I'm hoping to say a couple of take-home points. If you see a patient that presents with ocular symptoms, please ask about their exposure to decorative lenses and refer early to eye care providers. If you notice these infections or other poor visual outcomes, please report to the FDA, because we can only take action if we hear about it from you all. We also ask that if you notice any contact lens vendors selling without a prescription, notify the Food and Drug Administration and the Federal Trade Commission so we can protect our adolescent eyes. And if you have any more questions, I'm more than happy to answer them after the talk. And I'd like to thank the people on this slide who have worked diligently in helping to protect the U.S. public against these lenses. Thank you.